Health officials in the United States say the next 2 weeks are critical. The number of deaths in that country has now soared past 10,000. Public health officials have warned this week will bring more death and heartache right across America. Jackson Proskow reports.
In this critical time, New York's hospitals are being pushed to their breaking point.
Old people, young people, people are dying from this. It is lethal.
80% of the patients at this Brooklyn hospital are being treated for COVID-19. Nurses wear garbage bags and clean their clothes with sanitizing wipes. Doctors wear ski goggles.
We're seeing a lot of younger, healthier patients, and they're coming in a very critical state.
With hundreds of deaths every single day, funeral homes and morgues are overwhelmed. There are warnings that official statistics may not capture people who die suddenly at home.
That does happen in other epidemics, especially when the disease is similar to COVID, where people die quite suddenly if they do have serious complications from it.
New York's governor sees faint signs of hope. The number of deaths was relatively steady for a second straight day. Hospitalizations have started to fall, but it's not clear what that means.
There's also a real danger in getting overconfident too quickly. This is an enemy that we have underestimated from day one, and we have paid the price dearly.
And other cities are just now seeing their numbers surge. There are 15,000 cases in the state of Michigan, now the third highest number in the U.S., and there are fears of a public health crisis in poorer rural areas.
Those are the scary questions we all are wrestling with right now. It doesn't look promising for a lot of areas, particularly the U.S. South. It does not look promising. It looks like we'll have probably higher hospitalization rates than were anticipated.
In hard-hit New York, they're preparing for every possible scenario. That could include the short-term burial of bodies in mass graves in some city parks. Donna?
Unbelievable. Jackson Proskow in Washington, thanks. We will continue to consult with experts and try to answer your questions. You can send them to yourquestions@globalnews.ca. And on our website, you'll find a special page dedicated entirely to COVID-19. That's at globalnews.ca/coronavirus.